My name is Robert Marcolini, born and raised in Brooklyn. I come from a family of 6 children, of which there's just me and my sister left. The other 4 passed from some sort of cancer one way or another. I was going to my urologist and he noticed that my PSA was starting to increase over a period of a year. Sent me for an MRI. Then did a biopsy and we discovered I had prostate cancer. Dr. Silva was very comfortable to be with. He made this as not to worry, and it calmed me down 100% because I was very nervous when I found out that I have cancer, considering I was the last one to get it in my family.
How prostate cancer evolves and how it should be treated has changed. It used to be thought that you would have to treat the entire prostate in order to remove the risk associated with the tumor, even if it affected only a portion of the prostate. And it turns out they were all treated the same way. But this, with prostate cancer ablation using high-intensity focused ultrasound, is the next iteration, where instead of treating the entire prostate, now in a 2-hour non-invasive procedure, we're only treating the index tumor.
My prostate cancer, when it was found, it was just in stage 1, 1.5, and that's it. So because it was in early stages, I was eligible for the HIFU, and I decided to take it. He did the procedure, which I would recommend to everybody. It was so simple, and no cutting, no bleeding. My biggest problem was just the catheter for 4 days. Beside that, I would rather do this than go to a dentist.
Today, we're as minimally invasive as we can possibly get. Focal therapy with high-intensity focused ultrasound prostate ablation is non-invasive. It's even better than minimally invasive. Patient goes to sleep for 2 hours, they wake up, the cancer is done, it's gone.
My brother Pete, his cancer, the kidney cancer, he had had the kidney taken out, but it already spread. And he went for some treatment. They killed him. They killed him. He was suffering, and then it just spread and kept on spreading. And my sister Marianne had ovarian cancer, and she suffered too. She suffered very much. All of them went through hell for years. This HIFU, can't compare it. Non-invasive, no radiation. In reality, I went through 1 treatment. I mean, I had some follow-up MRIs and some blood work and stuff like that, but put that aside. It was no big deal, you know. I believe I had to be there at 6 in the morning, and we left a little after 12. And I was home, and I had a late lunch. And I enjoyed that lunch, I want you to know that.
The teaching mission for those of us who train residents is to teach them not just what they need to know to practice today, but to teach them the way they're going to need to practice in the future. Focal therapy is tomorrow's tool. Instead of treating the entire prostate, we only treat the portion that is the index lesion that we think is going to drive the biology of the tumor, and leave the rest of the prostate alone. And this is a complete change from the way I was trained, where we had to treat the entire prostate immediately in order to prevent death of disease.
I wish nobody has cancer, especially prostate cancer. But if you do have it, consider this. For me, it was the right move. I thank God for Dr. Silva, and I thank God for HIFU. Greatest treatment in the whole world.
Focal One, leading prostate care with robotic focal HIFU.